Monday, Medical Monday. Okay, so studies show that you can look up to 12 years younger just by having whiter teeth. There are some myths out there about whitening your teeth, and so we're going to get it straight right now with Dr. Terri Alani, the Texas Tooth Lady. Hello. All right. So there are all kinds of things that can affect the color of our teeth, and there's all kinds of products out there claiming to whiten your teeth. So let's start with the causes.
Okay, the first cause, as you know, we have enamel, and underlying the enamel is dentin, which is the second layer of tooth structure. So the reason our teeth yellow is the enamel thins over time. That can happen as we age. That's one of the main things. It can also happen if you drink a lot of acidic drinks. Now, believe it or not, between Red Bull, Coke, and Gatorade, which one would you think would be the most erosive to your teeth?
Gatorade.
Red Bull.
Red Bull, okay.
Red Bull is incredibly corrosive to the teeth. The other thing would be smoking. Smokers have a lot of discoloration over time. It builds up. It's very difficult to get rid of. Also, there could be medications you're on, such as tetracycline, some antihistamines, high blood pressure medicines. If you grind your teeth, if you're on any type of cancer treatment or radiation treatment, and also, lastly but not least, if you just have yellow teeth in your family.
Right?
Exactly.
Yeah, yellow or gray.
Exactly.
And things like that. Okay. So teeth whitening, some people are like, well, my teeth might be too sensitive, or my teeth are this, or can everybody whiten their teeth? Let
me enforce something. It is so important. You know, you have all of these small whitening centers that have opened it up that are not regulated by dentists. It is so important to have the dentist evaluate the underlying cause of your discoloration.
And we've mentioned this before, that dentists oftentimes are kind of like a gateway doctor in a sense. You can detect all kinds of things, whether someone might have diabetes. You do their blood pressure test, so you can kind of look and see what's happening right there as well.
Yeah, and it's really important. You know, we take x-rays. You need to figure out why, and also to make sure that your gums are healthy, because if you go in and your gums are inflamed, you're going to have a real issue whitening your teeth. So let's talk about reasons not to whiten your teeth, or what would be contraindicated. If you have existing crowns or just one crown in your mouth, your crowns will not whiten, nor will white fillings in your front teeth. So you might have to go in and whiten your teeth and then have that crown replaced. Now, some patients will come in and they'll have a tooth that's just really white. I know that dentist did not. I knew they did not put that tooth in like that. What happens is, as we age, our teeth yellow. So you can actually maybe do a whitening process that will bring your teeth back to that color of the crown in the first place.
The other thing a professional dentist does is that you can help us to match the color that we're supposed to have. Everyone always says, I want white, but it may not need to be
the
that
white
shade
of your
white.
eyes. It should be the white of your eyes. Also, if you have a gummy smile, people with gummy smiles have very short teeth, and if you whiten your teeth, you're going to accentuate that gummy smile. So you may be better off going into a gum specialist and having recontouring.
Yeah, or a snap-on smile.
Yes, or get a snap-on smile. A snap-on smile will correct a gummy smile.
Yeah.
And then also, if you have gum recession, that will cause some sensitivity, and that gum recession does not whiten because that's your second layer of tooth structure showing. And also, if you have an abscessed tooth, you need to figure out what is causing that discoloration. It's usually an abscessed tooth. It's not going to whiten.
Right. Okay. And sometimes with those things that don't want whiten, you can also do other things that you do. There's veneers. There's
exactly.
Yeah.
Well, snap-on smile and veneers or crowns.
Okay. Age factors, just 13 and older.
13 years and older. We don't recommend anyone under 13. Your teeth will be too sensitive, and older patients whiten beautifully. For younger kids, Crest White Strips are a great option. If you're 45 years and older, you'll take 10 years. You said 10 to 12 years off your age by whitening. Now, let's talk about the teeth that whiten the best. Tetracycline stained teeth, people have severe gray, can actually whiten. I've had so many patients come in and go, my other dentist said it's impossible. It's a combination of the in-office Zoom plus trays. You might have to do it for up to 4 to 6 months every day for an hour. Yellower teeth whiten the best. Yellow gray more difficult, and yellow brown easier than yellow gray. Gray is the most difficult.
All right, talk about the Zoom teeth whitening, because that's kind of
Zoom teeth technology. Whitening is in-office whitening. It is hydrogen peroxide. There's two types of whitening solutions. One is carbamide peroxide, which is 10%. It's a combination of hydrogen peroxide and urea. It's less acidic. These are what the home whitening trays are made of, and you can actually put it on your teeth for up to 10 hours. The Zoom is a hydrogen peroxide. It's very important to have it evaluated or regulated by the dentist, observed by the dentist, and to make sure that we cover your gums, because it is very concentrated, very acidic, and it can only stay on for only an hour. Yeah. Exactly. If you have sensitivity, we recommend you using Prevident toothpaste. It's got potassium nitrate in it, and you brush your teeth with that toothpaste for 2 weeks before your Zoom appointment. And if you just had your teeth cleaned, you want to wait 2 weeks before your cleaning to reduce that sensitivity.
All right. A lot of times we like to skip steps. Like, you know, we don't want to do the whole safety and the whole make sure they're healthy. We want to white first, and then we'll worry about the health later.
Yes,
right?
And as far as whitening toothpaste over the counter, all whitening toothpaste do is remove stain. Be very careful of these internet toothpaste, because I have a saying. My saying is, don't bargain on dental work, heart surgery, and parachutes. So you have to really be careful with the internet over-the-counter things, because the Crest White Strips work, but other than that, these toothpaste are basically just removing surface stain, whereas the whitening that's done in the office actually changes the genetic makeup of the enamel in the dentin.
The best thing is to go in for your regular dentist appointment.
Very important.
Get your teeth healthy first, your gums healthy first, check for any other issues, and then work on the cosmetic part of getting them whitened. All right, Dr.